I'm Jennifer Della Quadri, and this is the Raising Happy Teens podcast, where you learn how to successfully guide your teenager into adulthood without losing your sanity in the process. Let's do this. Welcome back to the podcast. In this episode, I invited Dr. Loretta Duggan on to give us some expert advice on how to support our daughters during puberty and beyond. As a board-certified family and adolescent doctor who focuses on supporting adolescent girls, she offers valuable resources and practical advice to help you navigate the challenges and celebrate the joys of this important developmental stage. Dr. Duggan opened her own private medical practice called Her Health to focus on the gynecology health of teens and young women so they can be healthy, empowered, and ready to live the lives they choose. You won't want to miss this important and informative conversation. Let's dive in. Thank you so much for being here, Dr. Duggan. I'm so excited about this conversation, and being the parent of two teen girls, I know firsthand how challenging this puberty phase can be. So I thought I wanted to bring you on as an expert, and I'm so glad you're here. Before we dive into all of our topics, let me give you a moment to just introduce yourself and tell my audience who you are.
Great, Jennifer. Thank you so much for having me. Really excited to be here today. And hello to everyone. My name is Dr. Loretta Duggan. I am trained in Family and Adolescent Medicine. I'm also the founder and CEO of Her Health. We're located in Athens, Georgia. And the goal of Her Health is to help 11 to 26-year-old young ladies transitioning to and through puberty to really confidently embrace their periods, their reproductive, and their sexual health to live the life they choose. So I'm really excited about our conversation on today.
Yeah, and I'm just curious, this is a kind of a niche area of the medical field. What inspired you to focus on this specifically?
Yes, it absolutely did not start out this way, not even close. I was 7, so I was one of the younger ones that figured out medicine would be for me after losing my grandma. And we were in rural Georgia, so it's like the access and having hospitals nearby, all the things you kind of think of that's needed to be healthy, we lacked, right? And so going into medicine, that was my focus. Prevention, primary care. I'm going to stop the heart attacks. I'm going to stop the strokes. We're going to help everybody, right?
Yeah.
But what I didn't realize was the power of my own story as well. I really struggled with my periods. They were painful. They were heavy. I didn't like them. I had to know when is this thing coming every month that I have to deal with for however many years until menopause, right?
Right.
And so kind of putting the two together now with Her Health, I can focus on prevention, but looking at it in a different way now from a reproductive sexual health lens, because you still want healthy ladies. That's how we have healthy babies, and even down the line, heart health, diabetes. We're helping in so many different ways to hopefully still prevent that versus catching it and diagnosing it and treating it later on. So it was more of a roundabout path to get here for sure. But once I was able to kind of narrow down and just learning and training that I don't have to suffer with my periods anymore. And I was like, I can't be the only one that doesn't know this. And that's really what drove me to more so my teenagers. In addition to just talking to them, I'm always learning something from them. And then two, now we can help them from a reproductive sexual health standpoint, because a lot of times we think of birth control as just that. It's birth control and it's birth control pills. That's it. But there's so many more options that are available. And I really like to term it as hormonal therapy. because it can be used in so many diagnoses. And I mean, I even learned myself what my diagnosis was. I'm self-diagnosing, because now I know what it is. I understand it. And
Yeah.
now I know there's help for it. So I didn't have to suffer. I didn't have to miss days, 1 to 2 days from classes or from training now
Yeah.
because I had an answer. And so that's what I wanted to bring now to my young ladies through her health.
That's so great. And that's really what it's all about is taking your challenge and your experience and being able
Mm-hmm.
to help other people
Yes.
on your path and after you've been through that. And when you were talking about, I can't remember what you said, but it reminded me of when my younger daughter first got her period and she'd gone through like the how to navigate your transition into puberty kind of workshops and classes, and she'd been
Okay.
educated on it all. But after she got her first period, I mentioned, so we'll get like the supplies so that we can plan for it. And she's like, "What do you mean?" And I said, "Well,
Mm.
you're going to be having this every month." "I am?" And I was
Yeah,
like,
it's
"Yeah."
a total shot for
"Well,
it.
how long?" I'm like, "Till you're like in your 50s."
It's gonna
And
be
she
a
was
while.
like, "What?"
She's like,
"What? Nobody told me
oh no,
that."
right.
So yes, it's something we deal with. It's something we as females deal with. And really what I love about the whole thing that you're bringing out is like, it's a safe space to talk about it and be like, hey,
Yes,
there are half of us in the country or in the world or whatever
that's
dealing with
right.
this.
That's
And it's
right.
something that we should be able to talk about and get help for and support with. So that's just amazing. So I'd love to just kind of start out at like where it kind of all begins is like that transition into puberty. So many of the parents that are listening, either their teen or preteen hasn't hit it yet or is right in the throes of it and kind of in the
Mm-hmm.
middle. And I always like to be able to provide resources and tools on how to best support the teenager. But if we could talk a little bit more about just what parents can expect and also how they can support their daughter as she transitions through puberty and starts to develop. So I'd love to hear some guidance on that.
Yes, no, great things because I know I didn't get a full puberty talk or anything either. So it's kind of like piecemeal and figured it out.
Yeah.
But one of the first things that you may be likely to see in our young ladies is development of the breast. So now they may need a training bra, they may need a regular bra, but they're starting to have breast buds that are starting. And at the start of that, that's kind of the intro. Like, okay, we have maybe about 1 to 2 years
Yeah.
before we get ready to see a period happen. The other thing with our young ladies too is we take off sooner, right? We are growing faster, we are growing taller than our guys are. So we may start to see that increase with height along with breast development as well as some of the first signs that we're
Mhm.
starting to enter into puberty itself, puberty.
Yeah.
The other thing that a lot of parents notice is those mood changes,
Yeah.
right? They're getting a little bit snappier. It doesn't take much now. And it's like, oh, I thought we were good today. I thought we were having a good day.
Yeah.
And that may not be the case. But all while they're adjusting and changing, seems like almost every day they're learning about their new selves as well. And one of the things I try to let my parents know is to not take it personal because they're going through these different phases of adolescence where they have early, they have middle, and they have late adolescence as well. So with early, around about 10 to 13 years old, again, kind of entering into those puberty stages, starting to see some of these changes, and it's pretty much black and white. Like yes and no. That's pretty much how it goes. What mom and dad or the family household says, that's what it is.
Mhm.
But when it gets to middle adolescence, that's around maybe around 14 to 17, things are starting to change where our peers are starting to influence them more, right? And then also they're still working through their transitions with puberty. They likely would have already started periods by this time as well. And it's a little bit more gray that's mixed in now. It's not just all black and white. What mama say is 100% now. No, they may start to question. Yeah, they're starting to question things now. And working towards their independence. They may want a little bit more privacy. The door is starting to close now. It's like, what? When did we start this?
Yeah.
Um, but those are some things that you may start to see as well, but not to take it personal because they're
Mhm.
kind of moving through that stage of adolescence. And then we have our 18 through 21, some may say 24-year-olds,
Mhm.
where, okay, now they're kind of starting to figure out life. They're a little bit more certain about themselves, able to think through my actions, my consequences,
Mhm.
what that means, because now they have more of that executive function, more of that
Yeah.
frontal lobe that
Yeah.
can keep up with the reward system a little bit better now.
Yeah.
So those are some of the things that you can start to see as they're starting to transition and move through these different stages of adolescence.
Yeah. So one of the things that I like to say is Q-tip, quit taking it personally, the acronym,
Yes, I
right?
love that.
It's
Yes,
so hard
Q-tip.
to do, but especially when you've got an adolescent that's going through a lot of changes and a lot of roller coaster emotions, to
Yes.
detach yourself. That's such a great reminder there for sure.
Mm-hmm.
And then as far as just reproductive health and being able to go to the doctor and everything, you being a doctor, what tips would you give to parents on how to support their teenager through getting their period and looking for any warning signs and things to be aware of, going to the doctor? Any tips around that?
Yes. So I say back in my day, but no one asked me about my period.
Yeah.
No one asked me, was my period coming every month? No one asked me, is it painful for you? So one of the things I definitely absolutely make sure to do now is ask those questions. And even for parents, they can ask as well. Looks like you're a little bit down, like she's struggling a little bit. Do you need something? Is it something that I can do for
Mhm.
you, while it's that time of the month? So being
Right.
supportive in that way is awesome because they're showing that you're being attentive to what it is that they need.
Yeah.
When it comes to going to the doctor too, allowing for that one-to-one, one-on-one time
Mm.
that they can have with their doctor. I feel
Mhm.
that is so important. And a lot of times, I mean, really can't or don't get a chance to get around to it, whether it's because of time,
Yeah.
just based on the system that we're in medicine, or is it that your doctor isn't comfortable?
Yeah.
We're not taught necessarily just how to have these one-on-one conversations and to do it efficiently
Mhm.
with teenagers. It could be that now I may find out something that's, oh, now how much time do I have to actually deal with it when I have all these other patients waiting? Or
Right.
it could just be, as a doctor, they're uncomfortable with it themselves, talking about sex, talking about birth control, and what that means in the setting of dealing with that patient, that teenager. But
Mhm.
for me, I definitely want that one on one time. And we have acronyms that we can use. The one that I like is HEADS. And with that, it's two E's, three S's. But with HEADS, that's what we're going to go through to kind of get an idea of the psychosocial life and activities that's going on with the teenager.
Okay.
And I love it because it's quick enough, but it's thorough enough as well to cover a lot of different topics rather during that time span. And I let parents know that yes, at some point I'll have you to leave the room too, because again, teens may not always share.
Mhm.
And then also I let them know about confidentiality
Mhm.
because there's some things that yes we can talk through together, possibly bring our parent or a family member, whoever's with us, back in the room and talk through things to support. And there are other times where, like, if there's abuse, sexual abuse, physical abuse, thoughts of hurting ourselves, those things are off the table. Those things are no longer confidential. We have to bring other people in to make sure that they're safe. So that's definitely discussed at the beginning with, whoever brought them there and with the teenager. And then as we get into heads, we're looking at H, the home life, who lives at home, do you feel safe, things like that.
Mhm.
One E is for education, another E is for employment, if they're old enough to work. So
Mhm.
tell me about school. Tell me about your classes. How are your grades doing?
Mhm.
Not just, oh, they okay. No, what grades are you making?
Yeah,
Give me some specifics, right? And
right.
then A is for activities. We're looking at activities that they enjoy doing with their friends. What are they doing when they hang out? Are we going to the movies and things like
Mhm.
that we kind of would expect? Are we doing some other things? You're like, tell me more about that. Do you think that's the safest way,
Yeah,
for you to go? So we're kind of thinking through those things.
yeah.
With D, we're talking about drugs.
Hmm.
And I never want to assume or automatically say, okay, you doing drugs? No, I look at the peers around them. Tell me what folks are doing around you. Anyone in your household like smokes or alcohol, vaping, anything like that. And
Yeah.
then we get to, okay, is it something that you've thought about, or is it something that you've ever tried before?
Hmm.
Again, not being accusatory, but kind of working your way from the outside in back to the teenager.
Okay.
And then from there, we're talking about sex, which I think most parents are assuming we're going to talk about. We're talking about sex, we're talking about self esteem, we're talking about suicide.
Okay.
So, sex, have we ever been sexually active before? Are we in a relationship, male or female? Again, no assumptions being made. What type of sex? Are we talking about penis, vagina? Are we talking about anal sex? Are we talking about oral sex? Because
Hmm.
that will direct how we can best counsel them on being safe, right?
Yeah.
Because if we don't ask, we won't know. And then in terms of their self-esteem, how are they doing with that? Are they having any issues with bullying? Or even are they the bully? Like
Right.
I have yet to have one to actually admit to that.
All right. I'm
But
the bully. I just gotta tell you.
right, I'm the one terrorizing everybody, right? No one's ever admitted that before, but I still ask both ways because
Yeah.
again, you never know. And then, of course, suicide as well, just
Hmm.
gauging where they are, how are they feeling with their mood, having issues with depression. And that's in addition to the screenings that we may have them do
Hmm.
prior to the visit as well, because did our parent answer it? Did, they just kind of mark something because they felt like they were being watched?
Right.
You never know. So I still like to ask about it and see where their headspace is when it comes to that. So that's kind of the things that I want to make sure that I address in that heads. And you see, it's pretty comprehensive. We're covering a lot of information in that, but it
Yeah.
gives a good insight into influences around the teen as well as where the teen is also.
Okay. And that really does highlight the importance of the teenager being comfortable around their provider,
Mm-hmm.
feeling
Absolutely.
safe and feeling like it's someone that they can actually be honest with. And so I know just from my experience, you have a certain doctor for a pediatrician when they're a baby and toddler
Mm-hmm.
and maybe a young kid, but things really shift when adolescence hits and there may be a need to get a new provider. And sounds like involving the teen in the process of finding the right provider would really come in handy in that situation.
Yes, and I think that's where adolescent medicine can start to come into play more. And I have to be truthful, I didn't learn about the specialty of adolescent medicine
Yeah.
until I was almost halfway done with my family medicine training. So it's 3 years. I was in my second year, and I was like, well, hold on. I can actually learn how to just take care of my teenagers too. Like that is so awesome. That is so cool. So I think a lot of people aren't aware of the specialty, and it's not like we're not as numerous as pediatricians,
Right.
but we definitely are out there. So when those things get a little bit more complicated, when we have to go into contraceptives, or we're talking about even some adolescents treat like substance use, substance
Yeah.
abuse, or even HIV treatment and things as well. So it's a plethora of things that we can help with depending on, who you see. For me, I focus more on gynecology health needs. But we do exist, and we exist for that reason. When it's time to kind of, okay, almost graduate kind of
Mhm.
from our pediatricians, then the adolescent medicine specialist can sometimes help bridge the gap in
Yes.
those cases.
Yeah, and I also just want to reiterate the importance to expressing to parents that it's important that they have alone time with their provider where they can
Yes.
talk about things they don't have to worry about mom and dad hearing.
Mm-hmm. No judgment, safe
Mhm.
space, open. We're just having a conversation. That's all I let them know.
Yeah,
And is anything you don't want me to tell, except for the confidential things,
right.
then we'll roll with it. But if there are some things that we've kind of talked through and you would like for me to bring someone back in the room so we can talk to it through it together, then absolutely, that's why I'm there to help in those cases as well.
Yeah, this is really helpful. And I'm sure some parents will hear that and be like, oh, I'm not really very comfortable with that. Like, I know my kid the best. And what if they're talking smack about me behind my back?
I can either confirm or deny.
That remains confidential. I'm not
Right.
going to tell you that part. It remains
That's
in the
right.
office.
That's right. But I
No, the
always,
assumption is you're perfect, mom and dad. You're doing great. We just want to have a space where she can talk about her own private stuff without you hearing it.
that's right. That's right. And I always, if there's something that, we need to bring them in for, I always let them know we absolutely will. And I encourage it to
Yeah.
encourage that conversation, encourage the
Yes.
communication between the family if that's something that the teen is open to doing. So I definitely want to invite that for them. But if they're
Yeah.
like, oh, I'm not ready yet, I got you. We can come back. We can talk about it later or, sooner than our next appointment if you like. And we can try it again if you're ready. So, again, no pressure. Try to open the doors for them so they know you have a space where they can go.
Yes, that's so good. And there's a different need for different stages. And honestly, talking to you, I really wasn't fully aware about adolescent um, doctors and people who specialize in that. I mean, it makes sense, but I just haven't had as much exposure to that.
Yeah.
So it's a really great reminder to parents to be like, hey, there is a specialty there for this age group, and to
Mm-hmm.
keep an eye out for that.
Yes, absolutely. And it may be at bigger like cities and
Yeah.
like academic areas, but you have some like me that are kind of floating around. We're doing like family medicine and we're kind of, into the adolescent medicine
Yeah.
space as well. So definitely keep your eyes out for us. We are out there and we're ready to help however we can.
That's so great. Okay. So, as far as tell me a little bit more about tips you might have for those three different stages of development. So, there's the young teens, the middle teens, and the older teens. From a medical perspective, especially when it comes to the females and dealing with periods and reproductive health and things like that, are there any specific tips and strategies that you would have for any of those specifically?
So I'd say most parents are going to have an idea kind of the level of development for their teen or tween. So for some, they know they can be more direct, maybe,
Yeah.
and it be okay. Some may be like, we might have to step it way back and keep it, very, very simple, very, very, just easier to digest until they're ready for more in-depth conversations as they get
Mm.
older. So early on, again, just even putting in the terms of, okay, we know that flowers have to reproduce. We know that we have puppies and kittens. Well, where are they coming from? Right? So we're keeping it very simple, but relatable for them.
Okay.
And letting them know, okay, eventually, maybe one day you will be able to as well. And if you have questions, let me know.
Yeah.
So allowing that door to be open because as they start interacting more with peers, possibly they may have more questions that comes up,
Mhm.
and that can lead to more in-depth conversations then. But kind of on the surface level when they're earlier on and starting the transitions, it may be better to keep it as simple as possible.
Sure.
And then now in our middle stage of adolescence, okay, now we can get into more of the maybe nuts and bolts of things. Yes, it's every 28 to 30 days. Now, you have an egg that's being released, sperm from our guys, and then there's still a process, but after fertilization, then the potential is definitely there
Mhm.
for a baby.
Mhm.
And of course, now late, they probably have heard more than
Oh
we
yeah,
can probably teach them
for
by
sure.
that time. But the biggest thing is being open, taking advantage of the moment, because sometimes they may come in, it's like late at night and you're getting ready to wind down, and they're like, I have questions. And we're like,
Right.
whoa, where did this come from?
Yeah. Surprise.
But and they're ready to talk.
Yeah.
So and it may be just for you to listen. They may not even want advice at that time. They may just be talking through some things.
Mhm.
So taking advantage of the moment as they are transitioning through now at later adolescence too, and acknowledging that, because now at later adolescence they're getting ready to kind of branch off,
Mhm.
hopefully on their own, and starting to get ready to take care of things, whether it's financially, more
Mhm.
self-discipline, managing their own schedule and things now. So putting it into perspective that they can understand, then know that you can still have an open door policy no matter how old they are. If they have questions, they can still come to you with them.
It always really does boil down to having open and honest conversations and being able to create a space of safety for them to be
Mm-hmm.
able to share. I had a friend who, when her daughter was in adolescence, she explained how her daughter was laying on her bed and that the mom was laying on the floor. And the daughter would write something like a question on a piece of paper,
Mm.
ball it up, and throw it over at her mom. And then
Right.
write the answer and throw it back. It's like, if
Yep.
that's the way that she can communicate by just writing and not saying a thing,
There you
you
go.
you meet them where they are.
Yes, yes. By all means, you do what works better for them, because guess what? When things come up, they already know that they can trust you, and they'll come to you first, maybe instead of other friends or things like that. They'll
Yeah.
come to you
Right.
instead to say, well, what do you think about X, Y, and Z? So the
Right.
earlier the better.
Yes, the earlier the better, keeping the lines of communication open, letting them have their own relationship with their provider, and that will really help them set the tone, it sounds like, for as they become an adult, so that they already have that standard of expectation and support in place.
Yes, yes, they can advocate for themselves. They can
Mhm.
advocate for what it is that they need for them to be their best selves. Absolutely.
Well, this has just really been a gift. And to be able to talk about these things that some people may be uncomfortable about hearing, but it's essential to discuss because this is part of our development. This is part of what our kids are going through. And I just really have to say that I appreciate that you're providing this service for your clients and that you also took the time to come on here and share with my audience so much of your expertise. This has really been so helpful.
Thank you so much, Jennifer. I've loved this and just so excited to bring this service to everyone and to really bless the adolescent medicine specialty, because I think it's so important what it is that we do and having these tough but needed sensitive conversations. So thank you so much.
All right. Thank you. If you liked this episode, I'd like to invite you to join Raising Happy Teens, my free online community for parents of teenagers, where every week I host Ask a Coach. You bring your parenting questions, and I provide expert advice and coaching. Click the link in the show notes to join today. I'll see you inside.